nominated Simon Murray. Simon's a senior manager at Northumbria Healthcare NHS Foundation Trust. Simon works in the north of the county and the centre of the county, where he manages all of our adult social care services, and is a lead officer for learning disability transformation services. Simon's a very can-do, practical, dynamic and pragmatic manager. Whenever you ask Simon to do something, he'll do it. If he can't do that, he maybe come to you and talk about that. He'll work within realistic timescales. He's a deal maker as well. He works in partnership with people. He understands the importance of working with external agencies, and he has an inclusive all systems approach, really whole systems approach to the way he works. He's an excellent manager and he's an absolute asset to work with. Simon was involved in the local and national response to the Winterbourne scandal. Prior to 2013, there was a BBC did a programme where they exposed a kind of abuse scandal in relation to people who have a learning disability and the way they were treated in some community establishments. The NHS took the lead and said that by June 2014, people who didn't need to be in campus-style treatment hospitals for learning disability should be discharged. In Northumberland, we had 17 people who had very complex needs. Some had autism, some had challenging behaviours, some had offending type behaviours and had been subject to sections of the Mental Health Act. Simon had under a year to work with commissioners to develop services, to find services, the right services for people, and to manage a kind of inclusive risk and independence approach to people having a community-based facility to live in, as opposed to being, living on a hospital campus site, which wasn't ideal at all. He managed that really well. I think off the top of my head, the national completion rate on time by June 2014 was about 7% for that. Locally, Simon had Northumberland at 67%, so it was a really excellent piece of work by Simon. But more importantly, I think the people who benefited were the 17 or 18 people with a learning disability who are now out of hospital and living in community treatment settings.
I nominated Matt Weir, who until June of this year was the quality manager for the adult and paediatric bone marrow transplant service, together with the collection and processing services. So Matt has great people skills, so he's prepared to go and meet anybody, from the porters to the professors, get alongside with them, find out what they do, and instill his infectious enthusiasm in order to get a job done. So he's great at bringing out the best in people, and creating an environment within the team that's very friendly and cooperative, and helps us to move on and get the tasks done that we need to do. So in the 18 months that he was with us, having had no prior knowledge of bone marrow transplants, he got us ready and took us through an inspection and subsequent accreditation for a system called JC, which is an international set of standards for bone marrow transplant units throughout the world. So there were 290 standards that we had to prove that we were fulfilling. And he created a quality management system which involves document control, training, a system of audits and a system of recording incidents and datixes. And as part of that, he also had an evidence document, so each of the 290 standards had a direct link with the documents that proved that we were compatible with those standards. And that was not only helpful for us in preparing for our inspection, but also made it very much easier for the inspectors at the time of the visit, because they could click on the links and immediately find the required documents. And that was just an example of one of the ways in which he helped us to get through this difficult inspection. Because he's such a personable guy, he managed to make us actually really proud of what we were doing and what we were achieving, rather than it being a complete chore all the way through. And we're already an internationally renowned transplant centre, but we had to prove that, and people don't always like being told that they've got to write documents for everything. But he made what might have been a tedious process actually quite good fun, which was very impressive.